Good afternoon. I'm Caitlin Lowy, Senior Director of Program Development with the National Kidney Foundation, and I'm here with my colleague Megan Schultz to discuss our article, Show Me CKD Intercept Initiative, a collective impact approach to improve population health in Missouri, which will be appearing in Mayo Clinic Proceedings, Innovations, Quality, and Outcomes. Our article highlights the effectiveness of the collective impact model as a foundational tool to develop an actionable public health strategy. We specifically demonstrate how it can be paired with localized data to ignite urgency and action among new stakeholders. Low awareness and late diagnosis are significant problems in kidney disease, and little progress has been made despite interventions in healthcare and community settings. We wanted to demonstrate if this framework could be successful in jumpstarting improvements in kidney disease by engaging multiple sectors and building a consensus strategy. Megan, can you talk a bit more about some of the specific outcomes we saw in our Missouri initiative?
My name is Megan Schultz, and I am the Senior Manager of Population Health Partnerships at the National Kidney Foundation. Our flowchart walks through the process of laying the preconditions for collective impact that were evaluated through the REAIM, Reach Effectiveness Adoption, Implementation, and Maintenance Framework. Our CKD data story was shared with stakeholders who could provide expertise around the challenges, effective solutions, and the resources needed for a path forward. 58 healthcare and public health leaders across 40 institutions in the state participated in one of 4 learning and action working groups to help shape the common agenda. The roadmap was launched at the Show Me CKD Intercept Leadership Summit, where 134 live participants from 71 unique stakeholder organizations gathered to learn of the recommendations composed to advance population health. In total, 159 stakeholders representing 81 organizations were reached in driving a cultural shift in primary care. Diverse stakeholder participation was essential for the effective engagement. 49% were unique organizations located in or serving Missouri communities disproportionately impacted by CKD. 71 of the 159 stakeholders, or 53%, made commitments to advance one or more roadmap recommendations at varying levels of support. And 68% of those who committed to at least one strategy were new or emerging NKF partners. We are continuing to follow up with these interested stakeholders to orchestrate next steps and continue to collect data. One integrated health system is implementing NKF's CKD Learning Collaborative, a model to evaluate and improve CKD quality of care in primary care. Beginning with CKD data analysis, the partner made updates to their EMR to reflect CKD alerts and modifications, as well to their order sets and dot phrase to reflect current guidelines. Over 60 learners across 3 pilot clinics were onboarded in February 2023, and teams will continue to review the performance data on an ongoing basis to demonstrate measurable change. Our findings have also been operationalized in improving public awareness and patient activation across both at-risk and diagnosed CKD patients. We have explored novel approaches to improve CKD testing rates through at-home tests and translated and disseminated CKD educational flyers to over 100 community partners who engage with diverse linguistic populations. Health equity will remain at the center of this initiative in addressing the social determinant of health barriers that contribute to the development and progression of chronic kidney disease.
A key component of collective impact is the use of data and shared measurement. Our future efforts will focus on developing shared data access and consensus on endpoints to demonstrate long-term impacts on population health. We will also continue to evaluate process outcomes and the sustainability of our Missouri coalition. In addition, we are scaling up this strategy to additional states in the U.S., so we have plans to evaluate the public health impacts of this work on a national level.